Hi, my name is Dr. Sankeerth and I am from AIIMS New Delhi of batch 2017, and I secured a rank of 2 in the November INI CET session. So I'm here to tell you about my whole journey for the process. So I did have my heart set on INI CET, or basically an entrance into AIIMS New Delhi for my postgraduate well in the start of my first year. So in the midst of my first to second year, I did consider MLE also in the process, but a part of me did want to stay close to my family and help serve my country. So I chose to pursue the PG course here itself. Now, as far as preparation for this course goes, it's more or less everything that you read in the course of your MBBS takes you one step closer to your PG. So well into my first year as well as into my second year, I would read textbooks, make sure that I get the source material in and focus on the PG exam at heart. Like while I was preparing for my professional examination, although I did have a larger goal at hand, at that point of time I focused on that particular exam because I know that it is a basic stepping stone for the process of your final entrance. So in my first and second year, I didn't use much of coaching material as reference, and at that point of time I did focus on a lot of my textbooks. But in my second year, I felt like that was a shorthand on my part. Like a lot of the other students did use that material, and with half of the effort that I had put in at that point of time, they were able to get the same score, and that kind of questioned my reading methods. So that was when in my third year and fourth year I started coaching, and those notes in fact did lay a sort of safety net for me to build on. It was like as soon as I'm done with the coaching material, then I have the freedom to read whatever beyond that I can. So in my third and fourth year, that was what made my foundation. And again, even in this phase of my life, I was just focusing on the next exam, that is my third professional examinations. And as soon as that was done, now the next focus was on my INI CET. The thing was that in our postings, the first most hectic posting was our village posting, and during that period of time, I was like it was hard to balance the NEET preparation, then INI CET preparation along with my internship. So it was at that point of time that I really started to reflect on what I want from the INI CET. A part of me wanted to escape all of this chaos and maybe take radiology or take dermat and live a life that gives you a work-life sort of balance. But certain events did transpire at the village. So it was on the fated day of Holi that this happened, that this is something that really made me motivated to keep studying and crack the INI CET. So on the eve of Holi, it was well into my 24-hour duty. So at that point of time, it was like no patient coming in the morning, but all of a sudden in the evening, there was an influx of like a large number of patients. So at around say 4 p.m. in the evening, there were like 3 ANCs who had showed up, and they were all at term, 36 weeks period of gestation, and they came to like this facility to deliver. And at that point of time, it dawned on me that there was no nurse, there was no junior resident, it was just me and my fellow intern. My fellow intern was kind enough to come to help me at that point of time. So there were 3 deliveries happening, and it was like in one of them there were complicated variable decelerations. The baby's heart rate was going crazy, the mother is bleeding, the mother is not able to breathe properly, and there was no resident to help us out. And at that point of time, we tried calling the ambulance also to refer to a higher center, and the ambulance person is also wasted somewhere because of Holi. So in that course of events, it was like we had to finish the delivery then and there, and then we prepared the woman, we put an IV line, started fluids, gave the person oxygen, kept the baby resuscitation measures at hand, we had the PPV in the background, the laryngoscopes, everything was set and ready. And when the baby was delivered, finally, the baby let out this huge, wholesome cry that just made my knees wobble at that point of time. I was like, Jesus Christ, this actually happened. The baby is healthy, the mother is happy, and then in fact the baby is crying. Not only is the baby crying, I am also crying at that point of time, and everything went well. And at that point of time, it made me consider that I shouldn't run away from effort. I shouldn't want like anything that's not giving me as much happiness as this. So at that point of time, I decided that I'm going to put my heart and soul into my preparation and make sure I get the department of my choice. And so from then on, I tried to fixate on whatever I could do to finish the syllabus till August. So we had our most hectic postings, that is the village postings for us, and Obs-Gynae Peds in the first few months. So I had set ki immediately after my final professional, starting from Jan 1st till the March end, I would finish my first 2-year subjects. So in that course of time, I did T&Ds from Bhatia, and I also did some of their core notes. So until the August end, I had finished my core notes first revision, and well into September, October and November, I started the rapid revision, that is the last minute rapid revision papers, and they were a very beautiful means in order to see what all topics are important for you close to the exam. So at that point of time, I did those. I did the previous year questions, and that was what my strategy was in the last 3.5 months. And I wouldn't recommend you to do your core notes in the last 3.5 months because that throws you off track. No doubt when you're reading a topic, you do want to know everything about its clinical features, investigations, management, and what and all you do to follow up the patients. But at your preparation level for INI CET, you do not need to know more than a few points associated with the disease. Yes, it is frustrating. Yes, you would question, why do I not know the rest of the points? You know there is some more information left behind, but you need to know that this is what is being asked in the exam and this is what you need to remember. The other are all optional. So make sure you get the need to remember down first and then only progress to higher information. So I would suggest that when you're in your last 3.5 to 4 months of preparation, start with the previous year questions for every subject and then go ahead and do your last minute revision papers, because in that way you'll be able to finish even huge subjects like medicine, obs, gynae, surgery in a span of around 2 to 3 days. So I had scheduled after my first reading, which took me around Jan, Feb, March, April, May and June in July. So 7 months for one revision I took. That was when I did my core notes. And even then at the end of that, my ranks used to be around like 4,000s, 8,000s. So it was only after that did I start reading the rapid revision and doing the previous year questions. And I had made it so that in 1.5 months, I finished one revision of it. And the next 1 month and another 1 month, I managed to do one more revision. Now towards the ending, when you're at your final revision, you have the freedom of leaving certain subjects that include like community medicine, medicine and pediatrics, and you can focus more on your first 2 year subjects along with surgery, obs, gynae and your minors. And these are extremely high yield, and make sure you do them even if you're confident with them. The last 4 days I kept for these subjects primarily because there are so many questions asked from them. So you need to have them at your fingertips and you need to schedule your revisions accordingly. I had set up like a list of days and all the subjects I would do at that point of time, and that was close to the exam. So I would suggest that keep your focus and make sure you do these rapid revisions. So after you've done your first revision of your subjects, that span, for me at least, it was a duration of 7 months. Then I started doing a more concise version of those notes. Like it's not like I would go back to my core notes. I would use say your LMRP. Particularly I found it useful for surgery, anatomy and medicine, because these are huge subjects and if you try to read it in depth, you would never have any ending to it. So the LMRP was really useful for them and I used them towards the ending. I'd schedule the last 1.5, 1 and 1 month accordingly leading into the exam. So that started for me from mid-August till mid-November, and in the first 1.5 months I did my first revision, and the next 1 month my second, and then final 15 days I did my third revision. So at that point of time when I was doing my third revision, I was not trying to read it in depth. I was just doing the LMRPs, the previous year questions, and I would even skip subjects which are not of high yield, which I would enlist as CCM, medicine and pediatrics, and I would keep the subjects which have high yield at utmost importance and revise them again. That is your first, second year subjects along with surgery, obs, gynae and the minor. I would also like to thank Dr. Ashwini for helping me with the NAT, because his notes were extremely pleasing to the eye as well as to the mind. It was a very beautifully, concisely put source of information, and it was something that you could revise literally in half a day, and that was something that helped me through for this INI CET. A last message I would like to convey is that the importance of resilience in this exam, primarily because you are bound to face disappointments, you're bound to face failure. It's one thing I've realized, that even the medical career as such rewards is resilience. You are bound to face disappointments. There are bound to be patients who are not happy with you. Similarly, in this exam, you're bound to have situations where your ranks do not meet your expectations, do not meet the level of preparation. It's important not to get disheartened and show up the next week with the same vigor. So I would just advise that focus on that primary trait of yours, that is your resilience.